Hi guys, I'm going to be presenting on expanding Medicaid services. So my bill is entitled the S.2067, which is a Senate bill, and it's entitled Affordable Health Care for Children with Disabilities Act. So I'm going to give a brief overview of what this bill entails, and it intends to increase federal funding to all states in order to increase medical assistance for disabled children. So as we all know, certain disabilities automatically qualify for Medicaid services, and those disabilities such as autism, Down syndrome, CP, MS, etc. But there are other disabilities that don't automatically qualify. Children have to apply and fit certain qualifications for these programs. So the bill's main goals are to disregard parental income limitations, and we're going to talk about other programs that don't necessarily take into account this qualification later on in the presentation. Removal of waiting lists for children who do eventually qualify, and disregard limits of payments to certain territories. We want equal funding to all states. Why? Okay, so why is this bill important? This bill is vastly important because of the cost of prescription drugs increasing, the challenge of copays. There's 20, $25, $35, etc., increasing every time a child visits a doctor's appointment and all of that. Frequent therapy session charges are increasing charges of medical equipment such as wheelchairs, adaptive equipment. We did that project last year in Dr. Bennett's class that specifically we looked at out-of-pocket payments for a wheelchair, cushions, or adaptive equipment, and those are a very high out-of-pocket service fee. So Medicaid covers lots of different things, and this is just the brink of what it covers. OT, PT, speech therapy, those behavioral services, long-term services, special education services, vaccines, and dental visits. All of this they don't have to pay out of pocket for the parents and the children with a disability. Medicaid covers these things. The obstacles of this bill are very high. Um, the bill was introduced, this is the fifth congressional period that the bill was introduced. That means that it was introduced five times already. And still, after all that time, it only has a 3% chance of enactment. And that's because somebody has to pay for the Medicaid insurance and all that equal funding. And who has to pay for that? That's the Committee of Finance. And unfortunately, the Committee of Finance has a favorable side of Republicans rather than Democrats. And this is very unfortunate for this bill because Republicans don't agree with the same affordable health care quality that Democrats agree with. Democrats agree that all people should have equal affordable health care, and Republicans just don't see that side. And the last obstacle is the lack of support from the co-sponsors. Unfortunately, my bill only has one co-sponsor, and that's Kristen Gillibrand, which is a positive because she is a U.S. senator, but she is a negative, which is because we need Senator Chuck Schumer to sign it, who is a New York State senator. Kristen Gillibrand is the junior New York State senator, so it is a positive that we have a co-signer, but a negative that it isn't more sponsors. So, who qualifies for Medicaid services? You have to be 18 years or younger, have a certified disability, and your family can earn up to 154% of the federal poverty line, which we'll talk about in a graph that I have labeled next. So, other insurance options, like I said early on the presentation, these are just a list of some of the insurance options that other children can apply for if they don't fit Medicaid's qualification. So Child Health Plus, for example, that is based on the child's income instead of the parent's income. Same with Tara, and then the Children's Medicaid waiver. Unfortunately, these programs don't have the same coverage that Medicaid has, so it's also a limitation to this bill. Here's a graph just to put in perspective of how much your family can earn up to with a child with a disability. So, for example, in a household size of one person, your parents can make up to $19,651. If they make more than that, they won't qualify for Medicaid services. So, that is $378 weekly. So, to put that in perspective, that is a very low number. Um, Many people make more than that weekly, more than that yearly. So continuing on, let's just talk about how occupational therapy is important to children. We work in school settings, early intervention settings. Without those OT services, children are going to be ripped away from their growth and learning in that fine motor, sensory motor, social skills development, and IDL, ADL training. So when qualified, we provide all those services in covered, not out of pocket. And these are my references. So thank you for listening. This bill is very important.